Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mrs. Zarina. May I know what brings you here today? Okay. Anything else? I'm very sorry to hear about your exposure, Mrs. Zarina, and I understand your worries, and I appreciate that you are concerned about your health. Okay, but before I come to the management part, I'll ask you a few questions to better understand. Is it okay with you? Thanks for your cooperation, Mrs. Zarina. So, Mrs. Zarina, do you have any picture of that rash of your neighbor? Okay, so you have macule, papule, pustules, or resting of papules. Thank you, Mr. Zarina. I take it. Yes. So, Mrs. Zarina, let me ask you a few questions to better understand your condition. Okay. So, Mrs. Zarina, if you remember that this is how long you were with your neighbor. Okay. You are in a closed room for 20 minutes. Okay. So do you remember you had chickenpox rash in your childhood? Okay. Okay, Mrs. Zarina, as you do not remember whether you had chickenpox in your childhood, so in your case, before I offer any treatment, I need to ask you a few more questions. Is it okay with you? Thanks for your cooperation, Mrs. Zarina. So, Mrs. Zarina, was you at chickenpox antibody level checks before pregnancy? Okay. And were you given chickenpox vaccine 2 doses 4 to 8 weeks apart in childhood? Okay. How many weeks are you pregnant? Okay. And when were you exposed to chickenpox? 1 day ago. Okay. Okay, Mrs. Zarina, have you developed any rash so far? Any fever? Have you had any cold, sore throat? And notice any joint pain? Okay. Do you have any pain on one side of body anywhere? Okay. Any vesicular rash in or around your ear or eye? Okay, Mrs. Zarina, is there any history of hospitalization previously? Okay, Mrs. Zarina, I'll ask you a few personal questions to better understand. Is it okay? Thanks for your cooperation, Mrs. Zarina. And so, do you smoke? Okay. If you are taking any steroids? Okay. Taking any medication prescribed by doctor or over the counter? Okay, Mrs. Zarina, how many children do you have? Okay. Okay, Mrs. Zarina, do you have high blood pressure? High blood sugars? What do you do for a living? Okay, you're a school teacher. Okay, and how are things at workplace? And how are things at home? How about your sleep pattern, Mrs. Zarina? Okay, Mrs. Zarina, is there any financial difficulty? Because maybe you'll need some expensive medicine, so will it be a problem if you have to buy? All right, Mrs. Zarina. Okay, Mrs. Zarina, if there is any immediate family member suffering from high blood pressure, high blood sugar, any heart-related problem, if there are any steroids. Okay. Okay, Mrs. Zarina, so as you stated that you are 28 weeks pregnant and you have been exposed to chickenpox virus 1 day ago, and you don't remember if you had chickenpox in childhood. Okay. So I'll offer a varicella zoster immunoglobulins to you and to your baby unborn, if it makes sense to you. Yes, Mrs. Zarina, it will significantly decrease disease severity Okay, and the duration of protection from varicella zoster is limited. Okay, and so for that reason, we'll check antibody status again 3 weeks after first dose of varicella zoster immunoglobulin. Okay, and shall give second dose if it's still a risk of further exposure more than 3 weeks since a first dose. Okay, if it makes sense to you. Yes, Mrs. Arena, vaccination is contraindicated if pregnancy or immunocompromised. So as you are pregnant, so I'll offer a tablet acyclovir, 800 mg. You have to take it 5 times a day by mouth for 1 week prophylactically. Okay, and with the gap of 4.5 hours. Okay, if it makes sense to you. And as you stated that you are a school teacher and to be on safe side, okay, so I strongly recommend you to stay off school, okay, and you need to stay away until maybe spots have formed or escaped. This is usually 5 days after the spots appears and 2 days before spots appear until all have formed escapes, usually 5 days after spots appear. Okay, but yeah, to be on the safe side, you need to stay at home for 7 days, okay? And there are some do's and don'ts, okay? So I'll encourage you to drink plenty of fluids, okay, to avoid dehydration, okay? And if you feel fever, you can take a paracetamol tablet, okay? And I'll strongly recommend you to trim your fingernails, okay? And don't share your belongings, okay? It is also as it can also spread by touching things that are fluid from blisters on them, okay? Yes, Mrs. Zarina, you don't have, but you have to be on very safe side, okay? And there are some don'ts, okay? And so do not use ibuprofen, okay? It may cause serious skin infections, and do not take aspirin as well, okay? And I'll strongly advise that do not put newborn babies or anyone who is with weakened immunity, okay? And if another family member is also pregnant, okay? Is everything clear till now? Should I repeat it again for you? Okay, Mrs. Zarina, you need not to be worried. I'm here to summarize again, okay? So firstly, we talked about that picture of your neighbor, okay? And then we talked about your symptoms, and then about if you had chickenpox in your childhood or not, and about the vaccination, okay? And then about your personal history, and about drug, and then family history, and then I summarized, okay? And then I advise varicella zoster immunoglobulins, okay? And I advise you tablet acyclovir, okay? And then we talked about some do's and don'ts, okay? And to take off from school as you are teacher, to be on safe side, okay? Is everything clear till now? Okay, Mrs. Zarina, is there anything else you like to ask me today? All right, Mrs. Zarina, here is a leaflet. It includes all the information regarding your condition, okay? I hope it will be helpful for you, okay? I wish you healthy life, okay? Take good care of yourself. Bye-bye.